So thank you all for coming out this evening. I think it'll be an interesting discussion. How many of you have actually had acupuncture? Okay. And how many of you actually understand what happened when you had acupuncture? Yeah. That's exactly, that's the thing. So this talk is basically, acupuncture 101. So the goals, basically just to give you an overview, who's practicing this medicine, a little bit about the conditions that can be helped, and introduce the basic concepts of traditional Chinese medicine. So the philosophies, theories, some of the terminology, and really, so that it gives you an appreciation of the complexity of this medicine. When you get acupuncture, I'm sure whoever has given you the acupuncture, they don't tend to say a lot. They might say things like, oh, we're balancing, your digestive system, or we're moving your qi, and just very kind of vague terminology. And there's a reason for that, because this stuff is really confusing, and we don't want to mislead you. So today is about delving into all of that stuff and really giving you an exposure to the real stuff, peeking into the mind of your acupuncturist. So finally, I'll give you some examples of the diagnosis and treatments, and then the role that acupuncture can play in an integrative model of care. And of course, that's been happening at the Kaplan Center for 25 years. But the rest of the U.S. medical system is starting to catch on to this. So here's a history of Chinese medicine in one slide. The first acupuncture needles were dated back to 1000 BC, so that's over 3,000 years of this history, which I'm not going to get into too much detail right now. But kind of the big moments are about 100 BC, the Huangdi Neijing, which is the emperor's the Yellow Emperor's Inner Classic was written, and that is actually still the basic, the fundamental text that's used in Chinese medicine, still relevant today. And as far as the United States, the kind of the big introduction to acupuncture in the U.S. was James Reston, who is a New York Times reporter, who had acupuncture in China when he was reporting, or he was following Richard Nixon, and had an appendectomy, and subsequently had acupuncture, and why wouldn't he write about it in the paper? And after that is when the schools started to become established in the 70s. And one of the things that brought, that definitely put the acupuncture on the map was in '99, when there was the National Institutes of Health did a consensus statement, or consensus conference, which reviewed all of the research and literature on acupuncture. And this list is actually from the World Health Organization, and I have that in your packet, of all the conditions that the research has shown that acupuncture is helpful. And at this point, we know that pain is managed really well by acupuncture, a whole variety of different things. And you can review this list, but there's more and more research is happening every year showing its benefits. So styles of acupuncture, there's pretty much as many styles of acupuncture as there are acupuncturists, but these are some of the major schools and theories. And today, what I'm going to be talking about is traditional Chinese medicine, which is one school, but just know that there's many other ways of the diagnosis is being done. So who am I, right? A licensed acupuncturist. What does that entail? What is the training involved? The licensure varies by state, but most states require board certification in acupuncture. In 2012, a survey showed about 30,000 licensed acupuncturists in the country. A very large portion, 37% of that are in California. The rest are mostly in these states: Colorado, Washington, New York, Maryland, Massachusetts, and New Jersey, which is not surprisingly where some of the major schools are. In this survey, there was 544 in the entire state of Virginia. And the national boards for licensed acupuncture is done by the NCCAOM. And a diplomat of acupuncture has to have a 3 to 4 year master's degree program, about 700 hours in Chinese medicine and acupuncture theory, of which I tried to cram most of it into the rest of these slides for tonight. There 500 hours in sciences, so there's a big element of knowing when to refer out to other practitioners, to physicians. And then some other pieces as well. For a diplomat of Oriental medicine, which is the certification that I have, there's an additional 450 hours in Chinese herbal studies. So I do acupuncture as well as herbal medicine. Physicians, because they have the background in anatomy and medicine, in order to be able to do acupuncture, they need about 200 to 300 hours, depending on the state, of acupuncture education and training. And the board certification for physicians is called the American Board of Medical Acupuncture. So some of the major principles that of Chinese medicine is the holistic concept. The body is one unit. You can't really break it down into specific, systems. And going beyond that, the body and nature are one unit, that we can't be separated from our surroundings. So, coming here from Seattle, the treatments, the symptoms that I'm seeing are actually a little bit different. And because of the climate difference, there is a difference in how I'm going to be doing treatment plans as well. In addition to that, the seasons affect treatments, where each individual resides. This is all a part of our makeup, and this is a big part of Chinese medicine. There's an overall analysis of signs and symptoms. So, when you come to see me, I'm going to be observing, how you walk down the hall. What is the coloring of your face? We have this term called the shen, which is the vitality. Do you have that spark in your eyes, or is there a dull look? There's a lot of observation involved. Also listening, the sound of your voice, your breathing patterns. Smelling is not something that I have been thoroughly trained in, but there are some practitioners that just by smelling, their patients can tell a lot about their patterns of illness. So inquiring, getting the basic medical information, medical history and family history. And then feeling is a big part of it. So, palpating the tissue, getting a feel for, any swelling or toughness of skin, if there's heat or cold, involvement. This is all part of the overall picture. And then this idea of having diseases and syndromes. So I'm going to be referring as diseases as Western diagnoses, and syndromes as the Chinese medicine diagnoses. So one disease can have multiple syndromes. One syndrome can manifest as multiple diseases. And these are examples of that. So in the case of hypothyroidism, so that's one disease that is characterized, by thinning hair, dry skin, a feeling of cold. sluggishness, there can be depression or memory issues, and from a standpoint of Chinese medicine, that can actually occur in 6 different syndromes, and you can see we have 2 of them are spleen, 3 are kidney, and 1 is heart. And if you take one of those, which is spleen yang deficiency, spleen yang deficiency it's characterized by cold extremities, which is very much in line with hypothyroid, excess weight. There's also an element of digestion, so loose stool, some edema, cramping. There's poor appetite and fatigue. So somebody who's spleen yang deficient is not necessarily going to present with hypothyroid or have the blood tests for that. But what they can have is other diseases, including IBS, depression, obesity. They can have chronic fatigue syndrome or infertility. So tongue diagnosis. I wanted to include this because this is one of the things I get asked questions about all the time is, you're sitting and you're having this nice conversation and then I say, will you stick out your tongue at me? And varied responses. So what am I looking at when I ask you to stick your tongue out at me? I feel like I should do that right now just to see your tongues. Thank you. So I'm looking at the tongue, the color of the tongue body. I'm looking at the coating. Is there a red tip at the end? So if there's a red tip, can actually be sleep issues. Paleness can be fatigue. A coating can be digestive issues. So there's all of these different the components that match up with these syndromes based on the tongue, and also pulse. So the pulse can show a lot about what's going on inside the body. I'm not just looking at the rate of the pulse, but also the quality of it. How deep is it inside the body? Do I have to push really hard to find it? Is it tight? Is it wiry? Or is it kind of flowing? There's all these different descriptions of, there's about, I think over about 28 different types of pulses that all give more information. So taking it back to its essence, Chinese medicine is based on yin and yang. And what this basically means, and it's a difficult concept to get your mind wrapped around for, if you're a Western thinker, linear thinker, but yin and yang are all about opposites being in balance and just the change. So, we think of like black and white and all the shades of gray, right? Well, for yin and yang, there's black and white, but they're constantly transforming into each other. So that's what the symbol represents, is the interdependence. You can't have night without day. And this is like just a normal part of the body and functioning. What's really great about this is that by definition, there is health, right? So when there's something out of balance, it means that something is not healthy. So you don't have to wait until there are, something shows up in your blood tests or, there's that pathology. You can start to see these signs in all these other ways that I've told you about before. And a lot of us just, do have an intuition. You have the sense that just there's something not right. And you might go to doctors and they say, well, no, everything is okay, and this gives just a little bit of a different perspective, or a lot of different perspective, right? So the word qi, I just thought I would also throw this out there because it does get a little bit lost in translation. It's usually translated as energy, but it's a little bit more than that. So it's the essential substance of the body, and all activities of the body are explained by changes and the movement of qi. So talking about kind of the physiology of Chinese medicine, there's different types of qi. The organ qi is associated with each individual organ. The channel is associated with the movement in the meridian that correlates with each of the different organs, and we'll talk about that in just a moment. And then it also is nourishing. It protects the body. So it's not just this kind of free-floating, I don't know, sparkly stuff that sometimes people tend to think about. So now getting to the heart of the discussion, we have Zong Fu. Tough crowd. So Zong Fu is the term for organs in traditional Chinese medicine. And it's a very abstract concept based on the interrelated functions of each of the organs. It does not refer to a specific tissue. So when I am talking with a patient and I mention, I might let it slip that there's a spleen qi deficiency, it has nothing to do with their spleen. In fact, the spleen in our bodies are related to immunity, and the spleen in Chinese medicine is all about digestion. So they're just very, of course, that's probably the most different example, but it does not correlate with the organs. And each organ has a corresponding meridian. So the Zong and Fu organs each are paired. So here you have, this is where I can get my pointer. So this is actually something I use to pick up needles if they've fallen and I have trouble getting through them. It also works very nicely as a pointer. So here are the Zong organs. And so there's 5 primary: lung, spleen, liver, heart, kidney, and also pericardium. And then the Fu organs, large intestine, stomach, gallbladder, small intestine, bladder, and then triple burner. Today I'm going to be focusing a little bit more about the primary Zong organs, which have a little bit of a stronger role. There's a little bit more emphasis on those. And the Zong are, talking about that dynamic balance. The Zong are the yin organs, the Fu are the yang organs because they're more exterior. The yang are going to be storing qi, blood, essence, whereas the Fu are going to be more for transforming and ultimately disposing food and waste. So each of the pairs that I showed before are linked to an element. So you might have heard of 5-element theory. So in the U.S., there's basically 2 main types of schools: traditional Chinese medicine, which is what I studied, and then 5-element schools. And the school that's closest to us here in D.C. is a 5-element school. And so they work pretty much exclusively with this system here, which is that each of these elements, which is fire, earth, metal, water, wood, are associated with their. So this is lung and earth is spleen, and when the system gets out of balance, they follow these patterns, and so they're kind of predictable in a way of when something is in excess, how that is going to show up in the body. So this is the, in addition with the Zong and Fu, the functions are very closely related, and the disease patterns affect each other. So now talking about the meridians, which are the pathways through which the qi, or that functional energy, is moving through. The channels, so there's 12 major meridians, and each one is named after one of those 12 organs, and they're sequential in their circulation of qi. So here, and I'm not sure if you can see this very well, but this is the kidney channel, and this is the bladder channel. And so in this diagram, the kidney and the bladder are right here. So the energy travels in this direction around the circle, and so it's going to go to the bladder and then the kidney. And so the bladder channel starts at the inner canthus of the eye, and it goes up around the head and goes all the way back down the back to the posterior leg, and then comes around and ends at the end of the pinky toe, and that's and then the kidney channel starts at the bottom of the foot and then moves up the inside of the leg and up to the front. So that's just an example of how it moves. They're separate channels, but they move one into another. And just like in this example, the Zhang meridians are anterior, the Fu are posterior, and you can actually use the channels in treatment. So I'll use, if there's an issue with the kidney channel, I'll use the bladder channel to help balance that out. So here are the functions of each of the organs, and you have this in your handout. The lung is kind of similar to the lung that we know about. It takes energy, qi from the air, and is responsible for the energy state in the body. It's the most delicate organ, so it's the most likely to be attacked. And we see that in colds and flus and all sorts of respiratory issues. The spleen, as I mentioned, is the organ of digestion. It transforms food into nourishment, and it transports nutrients and regulates blood. So it's going to be really important in energy. We see a lot of chronic fatigue patients are spleen qi deficient. Liver is responsible for the flow of qi in the entire body, including in emotions, in other organs, movement of qi, in digestion, and in menses. Heart, two main function: it moves blood through the vessels, and it stores. I mentioned that Shen. It houses that energy and is associated with a lot of mental processes. And finally, kidney is growth, development, reproduction. It holds essence, which is the most fundamental yin and yang, and it's critical to health and vitality. So a lot of issues related to aging are kidney, the kidney functions. So within each of these organs, there are the different patterns, the actual diagnostics. So heat, fire, cold, wind, damp, phlegm. So you can have like lung heat, liver heat, and then each of the organs have deficiencies associated with them. Qi, yin, yang deficiency, which again I'll give you some examples of those. And also and this is more getting into 5-element theory. There's season, taste, smell, tissues associated with each of them. And I included this in your packet so you can kind of review it. And from this, you can even see which element you tend to fall into by, the things that you crave, the things that you enjoy, and even personalities and body types. So now I'll get to the examples, and this is where hopefully things will start to come together a little bit, because you do have that confused look on your face that I was expecting. The lung qi deficiency is, so this is, within the lung organ, within that qi, specific qi deficiency pathology. These are the typical symptoms that we're seeing: cough, asthma, chest pains, shortness of breath, fatigue, and actually fatigue and daytime sweating are pretty much anyone who has qi deficiency, regardless of the organ, will show those symptoms. Thin white phlegm, weakness in the voice, weak immune system, And that tongue is going to present a little bit swollen, so there might be like teeth marks around the outside, or those little scallops, and with a thin white coat. And an example of, two patients that would be lung qi deficient, a 9-year-old with asthma, seasonal allergies, and eczema. So as far as those associations go, lung is associated with the skin. And so a weakness in the lung will also show a weakness in the skin, which is the eczema. And this is we know that these two are associated, but there's always a question of why. Well, in Chinese medicine, we know exactly why. It's the same pathology. So another example is a 36-year-old female, a smoker for 12 years, who catches colds frequently and has fatigue. So this is basically my treatment for these individuals. With the acupuncture, I am going to be, get to my pointer again, I'll likely use on the lung channel itself a couple different points. So lung 1, which is the first point that the meridian emerges on the body, on the surface of the body, is a really good point for tonifying lung qi. Lung 9 is the source point for the lung, and that's located right at the wrist crease. If there's coughing involved, I might use lung 7, which is known to descend lung qi. So like the natural energy flow of this meridian is to descend downwards. And sometimes what happens is it can go in the opposite direction. We call that rebellious qi, and that's coughing, it's hiccuping, it's like that, anything that comes up as far as respiration. So that lung 7 actually pulls that down. The other points I might use are on other meridians, but can affect the lung channel. Stomach 36 is the most common point that's used in all of acupuncture. So that point, believe it or not, is the most powerful point in the entire body for nourishment through digestion. It's pretty incredible, but I would use that point with somebody who's lung qi deficient. Another thing I just wanted to mention is with the example of the smoker, there's something called the 5-needle protocol, which is really great for not only smoking cessation, but also drug, alcohol dependence. And it's actually done in a lot of rehab centers, and people, non-physician, non-licensed acupuncturist, health care providers can get trained in this technique. And this is the 5 needles that get put into each ear. And it's not good for trying to get somebody to want to quit. I don't know how you can do that, but if somebody has put down whatever substance or the smoking, it can really help with cravings. So some lifestyle things that I would recommend are to focus on that digestive system, and in a minute I'm going to talk about spleen qi deficiency and the strategies for that. Having a clean, toxin-free environment, staying warm, using scarves. Remember how I said that the lung is the organ that's most vulnerable? Well, believe it or not, the way of doing that is to keep your neck covered. So out in cold, I mean, it's like the old wives' tale, right? Just keeping your neck covered, especially in the winter, can help with lung qi deficiency and increase your immunity. And don't exercise in the rain. That's just something one of my professors had said, and I thought that was pretty funny. Chinese herbs, I've listed a couple different formulas on here. The Chinese herbs can be really helpful for these conditions. So spleen qi deficiency is the next one, and again, this is super common. Especially in this clinic. We have poor appetite, fatigue, pale face, heaviness, weakness in the limbs, loose stool, is a kind of a hallmark sign with gas and bloating. Sweet cravings, sweet is the taste of the spleen. And again, that swollen tongue with teeth marks and a thick coat. And kind of diagnoses that are associated in Western medicine are IBS, food allergies, and chronic digestive issues. An example, 26-year-old female with poor sleep, daily headaches, lactose intolerance, loose stool, classic spleen G deficiency, and a 50-year-old female with fatigue, IBS, gas, and bloating. So what are we going to do for these? So for acupuncture, I mentioned stomach 36, and here's the stomach channel, and this is stomach 36 right there. Spleen 6 is another good one, so on its, those are, using those paired channels. Ren 12, which is actually right above the belly button and is anatomically actually located right above the stomach. And then another point, stomach 25, which is local to affect digestion. Those are fun points to put. Usually when I add those points, the stomach immediately starts grumbling and growling in response. And I would also use moxa on these patients. Some people are nodding their heads. So moxa is another type of stimulation for the meridians, not needles, but actually in the form of heat. So it's burning the mugwort herb over the points. And traditionally, acupuncture and moxibustion are literally the characters of the medicine are the same. So nutrition-wise, just having a clean diet that's easy to digest, fresh, local, organic foods, sweet, warm foods are your classic chi tonics, which include like carrot, squash, and we always call the worst kinds of foods, sadly, for the spleen are like ice cream. They're cold, dairy, and sweet. So I usually suggest that people, reduce those kinds of foods. So liver qi stagnation is I would say the most common diagnosis in the United States. It's anything that is worse with stress or emotions, symptoms that tend to get better with exercise. Depression is characterized by liver qi stagnation. Irritability, pain, sighing is a sign of that stagnation. Plum pit qi, which is the feeling that there's something stuck in your throat. At PMS, a wiry pulse is the quality of the pulse. And the liver can overact, talking about that 5 elements, it can overact on one of the other organs, including the lung, spleen, and stomach. So if somebody's really under stress and their asthma kicks in, that's the liver overacting on the lung. If somebody gets really nervous and has digestive issues, that's the liver overacting on the stomach. And so that's IBS, asthma, GERD, and depending on the situation. So examples, 38-year-old male with acid reflux, neck and shoulder pain, high stress, a 26-year-old female with painful, heavy periods, PMS, symptoms, miscarriage. A lot of women's health issues involve the liver. So this is kind of interesting. The 12 meridians are associated with the clock as well. Each organ has a 2-hour period during the day. The liver time is between 1 and 3 a.m. And if you're somebody that tends to wake up at the same time during the night, likely it's between 1 and 3 a.m. And that is the liver time, is the liver qi stagnation. So you might want to pay attention in the next slide. So liver qi stagnation is one of those that is fairly easy to treat because it's just about movement. If something is stuck, move it, right? Sometimes it's a little bit simplistic, but that's the idea in Chinese medicine. And acupuncture, if it's good at one thing, it's moving qi. There's 2 points on the body, large intestine 4 and liver 3, which are basically at the webbing of the hand and the same location on the foot, and those are called the 4 gates. And you put needles in those 4 spots, and things just start to move. Many of you may know that Dr. Gary is really focused on this overlap between chronic pain and depression. And from a Chinese medicine standpoint, pain is qi that's not moving, and depression is the same thing. It's qi that's not moving, and those are manifest either physically or emotionally. It's a novel concept in Western medicine, but it's pretty much textbook liver qi stagnation. Also, cupping can be really good for this kind of pain patterns. Lifestyle changes, anything that's going to get you to relax. Whether it's an increasing physical activity, doing breathing exercises, meditation. This is where massage and body work is really helpful. And doing sleep hygiene. So those times if you do wake up in the middle of the night, trying to get back to sleep as soon as possible. Nutrition, avoiding overeating, using pungent foods, and reducing stimulants, fried foods, alcohol, drugs are all very taxing on the liver, Western and Chinese.
So you're not saying avoid pungent foods?
Pungent foods are very good, yeah, absolutely. Garlic, all very good for the liver. The last one that I'm going to mention today is kidney yin deficiency. And remember, kidney is responsible for growth and development. It's storing that essence, aging related. Somebody who's kidney yin deficient will have lower back. The hallmark signs for kidney deficiency is lower back and knee pain. Also tinnitus, ringing of the ears, dizziness. And then the yin deficiency patterns are a smaller body size, constipation, thirst, night sweats, insomnia. But this insomnia pattern is people that can fall asleep really easily, but they can't stay asleep. So they tend to sleep really lightly throughout the night and wake up very easily. Also, because of the reproductive issues, the kidney yin deficiency is vaginal dryness or premature ejaculation. Examples: 62-year-old male with arthritis in his right hand, wrist, elbow, and knees, pain worse in cold, damp weather, borderline hypertension, and difficulty staying asleep. And then a 55-year-old female with hot flashes, night sweats, irritability, constipation. This is a lot of menopause symptoms are kidney yin deficiency. And the acupuncture points for kidney yin deficiency, a lot of them are around the ankles. So kidney 3 is a really great point. Spleen 6 is at the ankle. There's also points associated with each of the organ on the back. So even if you're not face up, we can still access these different points on the back. And I would do, in the case of the gentleman with arthritis, I would do a lot of local needling for his pain. Lifestyle, meditation, qigong. The Chinese are really big on limiting sexual activities to retain, and store that essence. Nutrition, a lot of water, moistening foods are really great yin tonics. Again, the Chinese, the medicine. Ginseng, is a common herb. We hear about it a lot. although to get the really, good ginseng, it's actually quite expensive. And we're actually taught that to not use ginseng until later in life because it's really powerful, but it doesn't last long. So you want to maximize when you're going to use it, the ginseng. But this is, for kidney yin deficiency, this is the time to use it. Okay, so to conclude, I've thrown a lot at you, a lot of terms, a lot of ideas, and but you can see that Chinese medicine really offers a completely different perspective. It's literally a different body that we're looking at. And with that different perspective, I think that there's some really great opportunities to be able to basically expand on what we don't know in Western medicine. So especially, pain management, chronic conditions, areas that right now the best solutions we have are pharmaceuticals, and some of them that have pretty nasty side effects. And so if you can use something like this that doesn't have quite the side effects, I think it's pretty powerful. Also, Chinese medicine is preventative, it's palliative. We can meet you wherever you are, whether you're just starting to notice that you're sick, or side effects from medications or chemotherapy. It really has a wide use. Challenges as far as integration, terminology. You can see the stuff that I'm talking about is a little wacko, right? And believe it or not, if another acupuncturist were giving this talk, they would use probably different terms, maybe even the same ones in different ways. So even in the field, we don't have a consistent language that we use. And so that's a big challenge in terms of the variety of styles and providers. But that's also the beauty of it, is that because it is an older tradition, it's evolved in a lot of different ways. And again, the field is kind of divided about whether to use the really traditional models or to modernize them and really just have them be anatomy based. And there's both schools that are thriving. But these are the challenges to integrating the medicine. So that's what I have for you guys. Can I answer any of your questions?